Professor Bhattacharya, we will
Yes.
move to your tenure as the ISCCM President now. All reasons, it was a very successful and happening year. That is what the general feeling. So we would like, and a lot of initiatives have happened in this 1 year time. So could you please elaborate about what all initiatives you have taken and how your goals have been met and what is the future?
Yes. I tell you that when I took over, I was a little bit mm, uh, terrified at that point of time because I saw that yes, there are so many things which was there in my mind, whether I'll be able to execute all those things during 1 year time or not. But I'm really thankful to my team, especially Dr. Bharat Jagyasi as a secretary and Dr. Srinivas Samavedam as a president-elect, because we are just right and left. They were sitting with me for all that. Whatever program I has to think, they are there to execute those programs. So neck to neck with me and step to step organizing for all of my programs. They executed everything in such a nice manner that today I feel that whatever I thought of, barring 5-10%, I have been able to execute almost everything. And I'm not only thankful to these two people, but also my executive committee, because there are many contributions from my executive committee members who have helped in different way, and we reached to this state. As I said, uh, how the first thing which starts when as soon as you take over as a president is the election that comes to your mind. Now, oh, this year there was a challenge because there was no vendor for election to conduct the election. And election process, as all of you know, that is one of the most controversial thing which happens usually. What we have seen in last 5-10 years, that maximum controversy goes on when we take elections in ISCCM. But this year, you must have seen that entire election was absolutely smooth without a single controversy or bias. So I again give the credibility to the team who were all involved with this election. And after the election, we are gearing up for our Eurasia. Eurasia, we did it although there were financial constraints, but successfully we did it with the very good help what we got from the local Bangalore team as well as from our executive committee. And this was the third Eurasia which we did in three consecutive Eurasias which were promised to Europeans, ESICM society, that these three will do. And after that, there will be a re-signing of MOU. So, because of budgetary constraints, I do not know, but Dr. Srinivas has to see. But it will be difficult because it happens that it creates a lot of problem for the future. That is why probably if we get a proper MOU signed as per our need through Europeans or ESICM society, then we'll conduct those conferences in future. Otherwise, probably it may come in a different shape or a different manner in future. So after Eurasia, because Eurasia was again almost attended by 800 delegates, and we saw almost 14 European faculties, they were there, and it was a very good success. Then there was another good thing which we did is that we shake hands with NATO organ. All of you know that this is National Organization of Tissue and Transplant yeah, organization for conducting transplant. So we shake hands with NATO, and there was a meeting on 3rd of August on that was the 14th National Organ Donation Day. They gave an award to us as the best supporting society for organ transplant in the country. And On 11th of August, there were again another meeting with them, and they said that every SOTO or whatever which are functioning in the country, they will walk neck to neck with the ISCCM to make all these organ donation and organ retrieval programs across the country successful. So that was another big development, and probably it will come on paper very soon. And then we conducted, as usual, the Teachers' Day. Then, uh, then our DEI summit, which was there in during the ARDS time, that was again a huge success. And then our ARDS Day, that was one of my brainchild, because I thought we must do it because it is not being done anywhere in the world. And in during that in the RDS summit, you must be knowing that Professor B.N. Gangadhar, he came as a chief guest, and at that time we discussed with him that there is a problem with the entrance exam of DRNB and DM, that anesthesia subject has been removed, and you must take it seriously because many anesthesiologists are interested to join critical care. Then he took it seriously, and within 3 months, we saw that there was a gazette notification that all the entrance examination for critical care for DRNB and DM, the subject will be critical care and not medicine or anesthesia. So that was a big achievement which has happened. And during ARDS Day, you must have been evidence that there were so many international faculties who are involved. And I feel that once we, because we were the person who started ARDS Day in our country, it should continue for years together, and we should be considered as the country who actually started this ARDS Day in the entire world. After that, we did this Sepsis Day celebration on 13th of September 2024. And as far as go to the research and guideline side, if you see that this year we took a promise that we'll make some guidelines by utilizing this grade methodology, because nowadays that is the only thing which is considered as the appropriate way of making guidelines. So we took the help of Dr. Bram Rochberg, and after that we are in the verge of finishing almost four guidelines which will be made as per the grade recommendations. So that is another new thing which has happened. And once this trend starts, I think in future everybody will take this grade methodology to prepare guideline, and that is the methodology which is internationally accepted, and you get all the credits which are actually given to the guidelines. So that is another important thing. Position statement, almost we are making around 6 and 7 position statements also this year. Then another big landmark which we have achieved this year is that we have signed MOU with almost 6 societies in the country with the association, because it was although we used to go and to participate, but there was no signed MOU with these societies. So this time we have made a signed MOU that will continue for in the all coming years, and ISCCM and all these societies will do combined meetings, academics and research works with Physicians of India, with Anesthesiologist ISA, with Chest Society. Then we did it with SEEDS, Clinical and Infectious Disease, then Indian Society of Organ Transplant, and also FISF, the Fungal Infection Society Study Forum. So all those MOUs have been signed, and we have started a synergy session, the conference also, that all these people from these societies, they should come, and they should give their deliberation during our national conference. So that was another achievement. Then celebrated our annual ISCCM Day in Mumbai. Then another important thing I tell you, this 10-bed ICU, which Dr. Sheila actually signed an MOU with this group. In 10-bed ICU, uh, they they actually wanted us to be a knowledge partner. So they were about to prepare around 28 modules, and we made a team from our ISCCM, almost 8 to 10 doctors, 8 to 10 ISCCM members were there, and all of them they worked day and night, and they prepared almost 28 modules for these 10-bed ICU, and we organized two physical or contact program, so that train the trainers program, you can say, one in Guwahati and another one in Bangalore. So there are two programs which are conducted, and almost 200 doctors from 10-bedded ICU who are running different intensive care units in Northeast and South. They got trained in these programs. Then this year we made this 4C course also in physical mode. We have revised so many courses like CCIDC and others, and that is one thing which was pending for 3 4 years, because CCIDC was getting old, and also the 4C wanted to be to come in a physical format, and that is one thing which has happened, and I'm thankful to the Kolkata Society for that. So as far as mm, uh, tie up with Noto is concerned, we also have requested to start uh, a Koto also. Means this is a city organ and tissue transplant organization, uh, because we see that we have city branches, 102 city branches. So if these quotas are formed, then it will be easier for our city branches to coordinate with them for all their organ transplant programs, which is going to be held in the country. And I have invited Dr. Anil Kumar. He is the chairman of NOTO in our conference, and he'll be there. And we have decided to give one special award to one of those ICUs who are doing excellent work in organ transplantation in the country. So myself and Dr. Anil Kumar, both of us will hand over this memento to the ICU or the hospital who are doing remarkable work in organ transplantation. So that is another thing which we have started. And another most important thing which I thought of was that, as per the theme, was the empowering community against critical illness, because this is the theme, and for that I assigned this heavy role to our vice presidents and asked them to conduct as many programs as possible in their different zones, so that most of those doctors who are non-intensivist, or those who do not have any awareness about critical care, they should become aware about critical care. So almost what I see at the end, what data which I have received, almost 8,000 doctors across the country have got this training of critical care, and they have been made aware about the critical care. So we did an outreach program in Goa. There also we have trained almost 400 doctors, and I myself was there, visited, and it was a highly successful program. We trained people from police line, we trained people from colleges, then we trained people from medical college where the students were there, but they were having no knowledge of critical care. Almost 100 students were there. So in that way, that was a huge success in Goa. That was an outreach program. And we have put a starting point for Indo-Asia Fellowship Program, and very soon, I think, the format has been prepared, MOU is almost signed, and in very soon we'll be starting an Indo-Asia Fellowship 2 year fellowship program that is already started, but I think Dr. Srinivas will take over that, and gradually it will take over. And not only that fellowship program, but here in the country also, as I said, we thought of doing this a fellowship program with Europeans. That was another important thing. I have extended an MOU with that, and with NABH recently we made a tie-up, and NABH has given us the access, and they have said you will be our knowledge partner, and I already have sent the MOU. They just have asked to refine it a little bit as per their need and requirement. So they have said you people will stay as knowledge partner for NABH. There they said that teaching, training, and making of quality standards, all those things, you will be our knowledge partner. And the most important thing, what they have said, is that your intensive care unit now can be recognized separately, even if your institution is not ready for that. So, if you feel that your intensive care is ready for NABH recognition, you just directly apply and you get your certification of NABH. So, that is another good thing which I have done. So there are many small things. I think this is some of the things which I thought of at the beginning, and I have been able to execute. And for that, as I said, my entire team from top to bottom, everybody has contributed in a different way. And rest all, I think you people have got time constraints. So I'm not describing all those things here, but definitely during the conference here and there, I'll be telling what all other things I have done for the society this year. Thank you.
Thank you, sir. Inspiring, impactful, covering the core curricular group and outreaching to the all corners of the country. And the leadership, the team has done a tremendous job. Hope and pray that your insights will be available for the society in future also. Thank you for that wonderful answer, sir.